structure of the cervical vertebra. So if we take cervical spine, here we will be having C1, C2, C3, C4, C5, C6, C7. So total 7 cervical vertebrae are there. Total 7 cervical vertebrae are there. C1 cervical vertebra name is called atlas. C1 cervical vertebra name atlas. C2 cervical vertebra name axis. Atlas and axis. These two vertebrae are atypical vertebrae. Atypical means these two vertebrae are different from another vertebra. So these two are different from C3 to C6. From C3 to C6, all vertebrae will be having same features. C7 vertebra is having both cervical plus thoracic features, because after cervical region thoracic spine will start, so that it will be having both cervical and thoracic spine features. Okay, we will see typical vertebra. Typical vertebra means from C3 to C7. Typical vertebra. What are the features? So suppose if we take normal, suppose for example here I am drawing lumbar spine. Okay, this is a lumbar spine. Here we will be having arch of the vertebra, spinous process, transverse process. Here faces, here superior and inferior faces will be there. So this is lumbar vertebra. Okay, just like example. Okay, suppose first if we take body of the cervical vertebra. So here body of the cervical vertebra is small. This is cervical vertebra. So this is cervical vertebra. Here body of the cervical vertebra is small, and at the same time the transverse diameter of the vertebra is large compared to the anterior posterior diameter. So when compared to the anterior posterior diameter, the transverse diameter is large in the cervical vertebra, and at the same time transverse diameter is large when compared to the height of the vertebra. Suppose if we are seeing vertebra from lateral view, this is the height of the vertebra. The height of the vertebra also very small compared to the transverse diameter of the vertebra, and at the same time at the lateral margins of vertebra is having some special processes. That special processes name is called uncinate processes. So here we can see these are the uncinate processes of the cervical spine. This we can see only in the cervical spine, and these uncinate processes are started prenatally. So before birth it will start, and after birth up to 14 years, up to 9 to 14 years, this uncinate process size will increase. Okay, this is about the body of the vertebra. And second point here we have to see pedicles. Pedicles means, what is pedicle means? Suppose if this is the body of the vertebra, so here we will be having posterior arch. Here we will be having posterior arch of the vertebra. So the place where the arch is connected to the body of the vertebra, this is called pedicle. So how it will be in cervical spine? So here the pedicles of the cervical vertebra are posterior lateral. Pedicles project the posterior lateral. Here these are the pedicles. Okay, these are posterior lateral orientation. Here we will be having superior articular facet, down will be having inferior articular facet. Same here also, superior articular facet and down will be having inferior articular facet. So that we can see. And lamina. Next point, lamina means this is the lamina of the vertebra. The lamina in cervical spine are thin lamina. The lamina in cervical spine are thin lamina and slightly curved shape, and orientation posterior medial. See here pedicles are posterior lateral. Here lamina are the posterior medial, so it is coming in this direction. This lamina is coming in this direction. So here these are looking posterior, mean posterior view, posterior. So these are in posterior. And it is the orientation is medial. So that's why lamina is the posterior medial orientation. And next one, facets. So facets. So here these are superior facets. So superior articular facets are oval shape facets. So these are going to articulate with the inferior facets of the superior vertebra. So suppose if I take one vertebra, here if I am having superior facets, here also I am having superior facets, inferior. So these are superior facets, these are inferior facets. So here what's the point means, superior articular surface is going to articulate with the inferior facets of the superior vertebra. So suppose Here one vertebra is there, here one vertebra is there. For this vertebra, this is superior, this is inferior. So here this is superior, this is inferior. So articulation between, see, superior facet of this vertebra. See here, superior articular facet, oval shapes. Okay, this superior articular surface of one vertebra is going to articulate with the inferior facet. See, inferior facet of the superior vertebra. For this vertebra, this is superior vertebra. In this vertebra, this is inferior articular facet. In this vertebra, this is superior articular facet. So these two are going to articulation. So this is called facet joint. This is called facet joint. And one more point here, the size of the facets from C3 to C7, see, from C3 to C7, size of facets will increase. It's very easy to understand. If we come from cervical spine to coccyx, so here the shape of the spine will increase. So because of the increase in the shape, here the facet joints size will also increase. The facet surfaces size also will increase. Okay, next point, transverse process. In this transverse process, it's a special structure in cervical spine only, specialty in cervical spine only. Here we can see a foramen. Here we can see foramen. It's a hole. That is transverse foramen. This complete, it is nothing but transverse process. This is the complete transverse process. In the middle we can see transverse foramen. Through this transverse foramen, some structures will pass. Which structures will pass means, here vertebral artery, vertebral nerves, vertebral veins, vertebral artery, vertebral nerves, vertebral veins. So that for that structures here will be having transverse foramen. And one more thing, we can see there is a groove for the spinal nerves. So this is the transverse process of groove. There is a groove for the spinal nerves. So nerves will pass like this. So there is a groove for the spinal nerves on the transverse process of the cervical vertebra. And next, the last point, spinous process. So if we see spinous process, so here the cervical spinous process are short. These are spinous processes are short spinous process. And at the same time, the end of the spinous process is split into two, that we can tell like bifid spinous process. This we can see only in the cervical spine. And at the same time, see here, C7 cervical spine, spinous process will be more. Okay, that's one point. And last point, vertebral foramen. Now vertebral foramen, see here what we are saying, this is vertebral foramen. It will be in triangular shape, and it will be big because the spinal cord should come here, so that the big vertebral foramen will be there. It will be in triangular shape, spinal cord will pass through this. So these are the typical vertebral structures of the cervical vertebra. Clear?